Hi, everyone. This is Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness in Anaheim Hills, California. Welcome to Wellness Wednesdays. I'm glad you're here with us. We sort of skipped last week. We had a hiccup in the schedule, so I apologize for that, but I'm glad you're here today. That being said, I have an exciting topic that we're going to talk to you about, something that hasn't been talked about in a couple of weeks, I think, at least for the most part, because of the current state of civil unrest. It's June 10th, 2020. There's a lot of stuff going on with protesters, crowds gathering, and, I'm not going to get into any of the politics around it, obviously, but certainly something that is social concerns. That being said, we still have this underlying current of COVID still happening. That coronavirus 19 is still out there. And in fact, I've had 2 positive patients here in the practice in the last couple weeks, last week and a half. We're at about day 10, 11, 12 with their recovery. So I just wanted to go through a little bit about what our practice offers specifically so that you can, I don't know where I'm looking. I want to go through a little bit about our practice, specifically what we offer for patients. So if you're concerned about developing COVID-19, if you're having any kind of symptoms, what do you do? I think that this has been a big kind of story that we're getting conflicted information about. We're hearing different things at different times from different providers. And so I wanted to be clear with you what it is we do here. So certainly here, anybody is welcome. If you are having any types of symptoms at all, fever, cough, shortness of breath, loss of sense of taste, smell, any kind of purple or bluish changes to your extremities, even GI issues where you're having nausea, vomiting, diarrhea, constipation, then definitely give us a call. If you're having any active fevers or you're concerned about a recent exposure to COVID and you're thinking, oh gosh, I think I really have this thing, we're happy to do an evaluation out at your car at the curbside. So we have plenty of parking here at the office, so we're happy to see you there. We can see a whole family if we need to, so bring the kids, bring the husband, bring the wife. All of those people, and we're happy to see each and every one of you. We'll take your vital signs out there. I can bring my stethoscope, listen to your heart and lungs, make sure you're nice and clear, and get a good, solid evaluation of what's going on with you. We do the nasal swab, which is actually much easier now than what it was in the beginning, where we had to go kind of all the way back to your brainstem. Now we just have to go right inside and kind of just to this area. So it tickles. It's not our favorite, but it's certainly not as terrible as it used to be. So very tolerable. If you're concerned that, hey, I was sick like in February, March, I don't know, maybe I had it, I'm not sure, am I safe? Is grandma safe to come down from Northern California? All of these sorts of questions. Then I think we should definitely get a COVID screen with the nasal swab, and then also getting an antibody screen to see if you have been exposed. And so that's a simple blood draw, and we send it off to the lab. Typically, we're having the results back. We had one hiccup where it took us like 5 days, but generally speaking, we get those results within about 24 to 36 hours. So our labs that we work with are really, really helpful for us from a customer service standpoint. They know how concerned our patients are, and so they make sure to get us that information relatively quickly so we can have that information back to you so you can take appropriate actions and precautions for your family. Then what do we do when we get a positive? Like, okay, so now what, right? And I've had this experience with a few of my patients who, once they've had a positive, they're kind of told, okay, well, then go home. Okay, well, are we going to do anything? Nope, there's nothing to do. You're not sick enough to be hospitalized, so go home, do nothing. Drink lots of water, take Tylenol if you have a fever. We'll see you back if you need to be hospitalized. So I feel like that's not really enough. I prefer to actively manage my patients rather than what we call expectantly manage. So when we're expectantly managed, it means like, well, just kind of let everything run its course, right? So we do that in labor. Let's let labor, you're going to be delivering a child. Let your body do things as naturally as possible. We're designed to do this. That's great. It's fantastic. Even with a common cold, common fevers, that sort of thing, oftentimes expectant management is okay. Like, our bodies are designed from an immune standpoint to be able to fight these things off, address them appropriately, attack the viruses, attack the bacteria, get it cleared out of our system, develop immunity, and move forward with our lives. We're designed to do this. Our bodies are amazing organisms, and they are very much able to do that. In the instance of COVID-19, however, I get concerned that people will lose their reserve and end up getting sicker and sicker and sicker, because what we're seeing happen with these individuals is not so much that they're getting sick and suffering from the virus itself, but more of our immune response to the virus. So that cytokine storm that we've spoken about in the past. So with that cytokine storm, that's what's damaging tissues. That's what's preventing people from getting well. It's actually our body trying to get well, but then it kind of goes rogue. So it's not doing its job appropriately. It's kind of an over response, almost like when we go into anaphylaxis with a bee sting. Our body's supposed to have a little response to to the bee sting, but it's not supposed to shut off our airway. Those of us who shut off the airway, then that becomes a problem. So this is sort of what we're seeing with COVID-19 for some of these individuals, is that their bodies may already be in an inflammatory state because of underlying chronic conditions, arthritis, even fibromyalgia, chronic stress, right? So I just put out an article about how chronic stress affects our cytokine levels and our inflammatory pathways. So if we're already starting here, and then we take an insult or a hit here, making that virus, then the inflammation only has so much more to go before it spills over into actually damaging our tissues. And that's some of the problem that we see there. So we want to make sure that we're controlling some of those bodily effects that our body is mounting against this virus, so we can manage it appropriately. So what we typically do in this practice is we assess the patient. Obviously, again, telemedicine is amazing. It's a wonderful resource that we can use for some things, right? For example, I'm checking my blood pressure at home. Hey, doc, I need a refill on the prescription that I've been on for the last 15 years, never changing a dose. I'm current on my lab work. Can I get a refill? Well, yeah, like let's see your list of all your blood pressures. They look pretty good. Looks like we don't need to change anything. Great. Give you that prescription. It's perfect, right? Even a paper cut, mosquito bite, those kind of things, yes, you can do via telemedicine. But even this last week, I had an individual who had an injury. They called me up and said, look, I think my daughter needs an x-ray of her foot. She dropped something on her foot. So I'm thinking, okay, I'm going to look at the foot and see if we think there's any broken bones, order an x-ray of the foot, get the results, and be done with it. And instead, when she actually came to the office, so not telemedicine, this would have been what I interpreted via telemedicine, is that, okay, she needs a foot x-ray. There's blood everywhere, right? She had actually lacerated, and lacerated her toe, avulsed the toenail. I mean, it was a wreck. We got her fixed up, but that was not something that we could have done via telemedicine. So telemedicine does have its limits. Coming back to COVID, sorry, I digress. I get really excited. Coming back to COVID and how we manage it here, we assess the patient, see if there's any allergies, interactions, ill effects from any other thing, and then decide whether or not that patient needs to be put on an antibiotic. Typically, what we're seeing is most patients do pretty well with the Z-Pak or azithromycin. I had a great patient ask me the question, why is it that we're using an antibiotic for a virus? We should be using an antiviral, right? Because antibiotics work against bacteria. And I was like, God, that's a really good question. I actually had to look that one up. So actually what we know is that azithromycin not only has antibacterial properties, it also has antiviral properties that are grossly underreported. So this is why people, even with a bronchial, like a viral bronchitis, will do well if you put them on a Z-Pak. Again, arguably, they would do well anyway if you just wait it out. But I tend to be more on the proactive end of things, particularly if somebody is suffering. It's kind of needless suffering. So we try to kind of preemptively strike. In addition to that antibacterial, antiviral properties, azithromycin also has antioxidant properties. So again, we're helping to deal with all the free radicals that are floating around in our system from that tissue damage, from what the virus has destroyed, and also what our own cytokine response is destroying. Then it actually kind of walks that back and helps our body to bind those free radicals and get rid of them. So our body's not in a toxic, inflamed state. That's why Z-Pak works, okay? Early on in the whole COVID crisis, there was a lot of conflicting, shots across the bow. There's a lot of stuff going on when we're scrambling from a medical standpoint to try to figure out what's going to be the best management for our patients. And I recall them saying, like, do not use steroids. Steroids are not helping individuals. Don't. Since then, we've sort of walked it back a little bit. At least there have been some people who have walked it back, who've actually looked at the literature and looked at case studies, and people actually do well with steroids early on. We have to look at when these studies are done, guys. So one, follow the dollars. Who's paying for the study, right? If it's a big drug company and they're against the drug that they're studying, they're going to say, oh, Z-Pak doesn't work, right? Because we want you to use our drug. So I hate to be very cynical about it, but it's important to know that information when you're sort of dissecting out the data, right? Nextly, look at what stage, what age, like who are the patients that they're testing and giving you reports on? Are these outpatients? The people who are in my office setting, or they're staying at home? Or are they patients who are in a skilled nursing facility? So, they're already sick and they're confined and in an environment that's not going to be as healthful. Or are they in the hospital, which means they're in a much more acute setting? They're very acutely ill, much more severe. Are they needing a ventilator, right? So if you already kind of have proverbially one foot in the grave and now we're trying to dig them back out, there's going to be very little we can do at that point to help you, no matter what medication you pull out of your hat. So this is why when they did some of the earlier studies and I go, steroids don't work, well, it's because they're already in such a hyperinflamed state. They're already so sick that really nothing in your armamentarium is going to work. And that's what we were initially seeing. And we're seeing that because we are expectantly managing patients for so long, waiting for them to get super sick. Then we're trying to intervene. And so for us at this practice, we tend to kind of intervene very early on. Look, let's get on a Z-Pak. We need to start steroids because we have underlying airway issues or underlying inflammatory responses to things. Let's get everything kind of settled down and let your body appropriately deal with this virus. Okay. What do we do in addition to that? Because this is where it really becomes key, where we marry kind of complementary medical options with traditional medical options. Because right now, traditional medical options are very, very limited, right? Don't even get me started on Plaquenil, which I think is a great drug. I've had patients who are pregnant who are on Plaquenil throughout their pregnancies. It's a very benign medication. It's been around for hundreds of years. People do well on it, but now it's so politicized that you're almost like a pariah just to even mention it to a patient. So we're not going to talk about that a whole lot. But that being said, what can we do in addition to? Well, we know that a vitamin D hammer works very, very well. So what is a vitamin D hammer? It's actually taking 50,000 international units. How are you, Ryan? 50,000 international units of vitamin D daily for 3 days. Now, that's hard to find outside, right? So you can go to the pharmacy and you find maybe 5,000 international units. You're going to have to take 10 of those every day for 3 days, okay? Or you're going to find the 10,000, in which case you're going to have to take 5 of those. When you're not really feeling well anyway, it's hard to swallow, you're kind of punky, right? So you really want to get on top of that. We have the 50,000 dose here in the office in one capsule or one tablet, so it's easy to take. It's done. You also want to give that to your loved ones who are in the same household. Really, anybody over the age of 15 can take this safely, okay? So get them on board with it as well, because vitamin D actually is a huge, huge cofactor in helping our immune system to fight off viruses and bacteria. So it's very, very important to get those vitamin D levels up like now. Okay. What else do we want to do? We want to add zinc. Again, zinc is an important mineral that we need typically absorb through our diets, but we're chronically deficient in. Particularly as we age, we tend to get more and more deficient in zinc. Okay, now whether that has to do with our gut biome and so forth, again, that's another topic for another Wednesday. That being said, sorry, there's a lot of pinging going on. That being said, we can supplement with zinc. So again, zinc lozenges, Zicam, there's a number of things that are available over the counter that will be very beneficial for you for your immune process. Zinc actually changes the cell membrane such that the virus cannot gain access into the cell. Now, viruses and bacteria are very different. Bacteria can reproduce on their own. They can just sit on a surface and proliferate, right? They can just make more of themselves. And so that's bacteria. Viruses are dependent organisms. They absolutely need us. They need access to our DNA, which is inside the cell. They need access to that DNA in order to replicate. Otherwise, they're just a couple like random viral particles running around, and they can't really take a foothold and they can't reproduce unless they get into the cell. Okay, so zinc actually changes the cell membrane such that it just is a shield. It can't get in. So if that virus cannot get in, then you cannot have it replicate. Okay, so then it can't take a foothold. You can't get more sick. So why wouldn't you take zinc? Okay. So again, these are like elements that you can add where you're certainly not going to do any harm. Am I telling you that it's going to cure COVID? No. But in combination, you're hopefully going to have a better response to COVID such that you're not being hospitalized, not being placed on a ventilator, and not dying from the disease. Still going to feel crummy. There's no doubt about it. It's still going to have to run its course, but can it be a milder course than that which you would have experienced if you don't do any of these things? What I've also been typically doing for patients is an IV hydration. We do 1 liter of normal saline with vitamin C, like massive amounts of vitamin C. Because again, you can tolerate orally maybe 500 to 1,000 milligrams, and our GI system can usually put up with that. But you can't get much more, and then you're still relying on your GI absorption, particularly for those who manifest GI complaints that they're having nausea, diarrhea, everything's running through them. They're not really absorbing. Right? So we bypass that absorption factor by giving you an IV infusion of vitamin C. We do 5,000 milligrams, so substantially more than you would be able to tolerate orally. We combine that with zinc IV. So again, not getting it through the absorption of your gut, but actually through the IV, and also B complex, which helps with immune function. So doing those 3 in combination along with just the hydration itself. Right? I think a lot of times in medicine, we lose sight of the fact that when you have fevers, when you're sick, your body is in fight mode, right? You're sweating, you're hot, you're vasodilated because everything's warmed up in your tissues. So everything's kind of dilated out. We're losing a ton of insensible fluid loss through that process. Again, it's a very natural process, it's an expected process. But how do you stay hydrated during that? And again, if you're having issues with diarrhea and everything you drink just runs through you, you're not absorbing it. And we don't do well when we're dehydrated. So even just the hydration alone helps these patients through this process so that they do much better. So typically I'll see my patients back twice a week, once a week, ideally twice a week. I'll stab you in the arm. We'll get you your IV hydration, but even once a week, they've done very well. So again, it's not that they're not miserable. Okay. It's not that they're not sick and they're like laid up in the room and the wives are keeping them all locked behind the closed doors and sliding their soup under the door. That's absolutely happening. But my patients have not been hospitalized. My patients have not been placed on a ventilator. My patients have not died. So those are kind of the endpoints that we're looking at, right? Really, those are the critical things. But did you die, right? So it's not that you didn't get infected, but did you die from it? And so we have to monitor and modulate how your body's response is to this virus. So that's what we try to do here. We always pride ourselves in really working with the patient individually to make sure that you're getting the best care for you. So while this is what I have implemented for the patients that I have cared for, if they're like, hey, look, doc, I don't want to take Z-Pak. Don't. Totally fine. You know what? I don't really do well with zinc. Like me personally, I can't take zinc orally. It makes me horribly sick. So that's hard pass for me because I'm not gonna be more sick by taking zinc. So even though I know how much benefit it gives me, I cannot take it in its pure form. I'll take it through an IV, but I will not take it orally. So again, that would be a conversation that we need to have about how your body responds to a variety of things so we can tailor and customize your therapy and get you the best outcome. So if you have any questions, please give us a call. Make sure that you subscribe, hit notifications so that you are notified when we have the next video coming out. I'm looking forward to doing our Field Trip Fridays this Friday. If you have any questions or comments, please leave them below. We'll talk with you soon. Stay well.